Commerce. He's the head of Swiss compartment. He currently holds the position of director and head of Combifar Consumer Health, and he's also the CEO of PT Sarana Utama Karya, a toll manufacturing company. The last but not least, we have a very prominent player as well from Indonesia. He's Mr. Ferry Sutikno. He's the CEO of Dexa Medica. His background is a graduate from ITB Indonesia and University of Pittsburgh. And currently he's also a member of the ISPE Indonesian chapter as advisory board, and also the GP chairman, GP Pharmacy Indonesia as vice chairman. Please welcome these distinguished ladies and gentlemen as our speakers. And as a beginning to kick off this webinar, His Excellency Mulia Haddad, the floor is yours.
Thank you, Jesse. Good morning, everyone, and good afternoon for those of you who are in Indonesia. I hope everyone are safe and healthy in this challenging time. First of all, I would like to thank everyone for participating in this webinar, both from YouTube streaming and Zoom, especially to our speakers, Pak Francis Wanandi, Ibu Paulina, Mr. Urs Lehmann, and also Pak Ferry Sutikno. Thank you also, Pak Jesse, that's just now presenting the speakers. Ladies and gentlemen, this webinar is collaboration between the Embassy of the Republic of Indonesia in Bern, Switzerland, and the Swiss Asian Chambers of Commerce. So I'm thanking also the people involved in making this webinar possible, namely Barbara and Jesse. Ladies and gentlemen, honorable participants, the theme of this webinar, Swiss herbal medicines and the potential of trade and investment in Indonesia herbal industry, is, in my opinion, very timely and very important, especially as the world now facing a global pandemic that we know that no one knows the cure yet. Let me give a few facts and potential on the herbal markets and Indonesian herbal industry in particular for a little bit of background. Firstly, herbal medicine, as we know, is not new for humanity, and it has been practiced since thousands of years ago and still going on. Secondly, according to WHO, 80% of population of the world still rely on traditional herbal medicine for primary health care needs. Thirdly, both in advanced and developing worlds, herbal medicines is gaining popularity, and it is increasing day by day because of their efficacy, safety, and lesser side effects. Fourthly, global herbal export market continues to grow, including European Union, North America, Australia, Japan, and Singapore, while Brazil, Argentina, China, and Indonesia is now as a new emerging herbal markets. And lastly, Indonesia has millions of medicinal plants which are developed to add value to herbal-based industry, far greater than any other countries. A country that has no less than 30,000 species of plants and marine products, marine resources, Indonesia can become one of the largest exporters of the herbal medicine product in the world. Ladies and gentlemen, based on government regulation year 2015 concerning the National Industrial Development Master Plan for the period of 2015-2035, the pharmaceutical and cosmetic industry, including the traditional medicine industry, is one of the mainstay and potential sectors of Indonesia. This means that this industry is prioritized for development because it plays a major role as the main driver of our national economy in the future. We have Pak Ferry Sutikno here from Dexa Medica, one of the biggest herbal pharma producers in Indonesia. Despite Switzerland's lack of natural resources, Switzerland is known for providing bespoke pharmaceutical solutions through its access to and funding for intensive research and development of these fine chemicals and herbals. The global demand for this product is always increasing, which makes Switzerland its asset valuable. I don't have to tell you that Switzerland has been many success stories and inventions in pharmaceutical industries. The Swiss pharmaceutical industry now offers more than 30,000 products and is well positioned to make significant contribution to healthcare both in Switzerland and worldwide. It is contributing to around 30% of Swiss export, bigger than contribution of chocolate, cheese, and watchmaking export combined. More than 135,000 people are working in this sector, making Switzerland is an attractive pharmaceutical companies to set base. Once again, herbal medicine is in the pace of increasing demand and fast growing both in advanced and developing markets. It is our obligation to leverage this opportunity and face challenges not only associated to regulation and safety rules, but also to quality control and its supervision and development. To make it simple, let me just say that Indonesia and Switzerland complement each other in this field. I don't want to make further time, and I give the turn to the moderator, Pak Jesse, so that we can begin this webinar. I hope that we can have a fruitful discussion and that the potential trade between Indonesia and Switzerland, especially in the herbal industry, can be fulfilled in the future. Thank you very much. Back to you, Pak Jesse. Please unmute, Pak Jesse. Yeah.
Oh, okay, hold on. Hello, can you hear me?
Okay, go ahead.
All right. Okay, go ahead. Okay, His Excellency, thank you very much for your speech.
No, it's a video sign, a video.
Please welcome the next speaker, Mr. Usleman. He is the CEO of Simulasan AG. Mr. Usleman, the floor is yours. Please go ahead.
Oh, here we go. So here we go. Good morning and good afternoon to everybody. My name is Urs Lehmann. I'm the CEO and co-owner of a Swiss company called Simulasan, and it's a huge pleasure and honor to be with you today and to give you a short introduction about our company. And I've already learned a lot that the pharmaceutical industry is more important than chocolate in Switzerland. I didn't know that, but I take that as a compliment for our industry. So I don't know, are you sharing? I prepared a presentation. I don't know, Jesse, whether you're going to show the presentation or do you want me to share my screen? I don't hear you, Jesse.
Sorry for this automatic mute. Okay. The team from the embassy will beam the presentation. If you cannot do it yourself, now it's up to you.
I was told somebody of you would share the presentation. So
yeah. Okay.
Di bawah.
So in the meantime, I think I will do a short introduction, maybe 7, 8 to 10 max minutes, and then leave the floor open for some questions. And my goal is to show you a little bit who we are and what we are doing and where in the world we are active. So does it work with the sharing, or do you want me to share it then?
Mr. Lemon, please do the sharing. And I think because your timetable is also quite tight, after your sharing, we can open some question and answer for you. Okay. If there's any question, then yeah.
Okay, so maybe I'll open my file and then we go back. Here we are. So let's hope this will work. The host should allow me to take over the screen, whoever the host is, otherwise it's not possible. Jesse, are you the host or who's the host?
The host is Mr. Nuradi Nuri from the embassy. Yeah.
So if I can ask him to open the screen, otherwise I'm not allowed to share my screen.
You can share the screen. I already approved it.
Mr. Lehman?
Yes, here we are. Here we are. Here we are. It's good. Okay. Good. Okay. So everybody can see my my screen, my presentation. Jesse?
Yes, yes, okay, I can see that. Yeah.
Okay, wonderful. Okay, so let's start. So our company called Similazan was founded in 1980 by 3 chemists. You see them up to the left, 3 wonderful guys at the time, very modern glasses and beard. Today, 40 years this year, anniversary, so quite a big event for us. The owners is family Justrich, the Michel Justrich, the chairman, and I'm the co-owner of the company. Basically, we are a so-called family-owned Swiss. We are proud of being Swiss and private company. The product categories or services we are in is homeopathic remedies. That's how our heritage was built over the decades, over the years. Today, we are mainly in eye care, in the OTC and OTX business, and here in the natural section, you will find us, not only homeopathic, but natural. And what we've been doing too is some contract manufacturing. You see our plants down in Jordan, the headquarters. That's where we have our manufacturing side too. On the right-hand side below the picture is our subsidiary in Denver. It's not the whole building. I would love to own the whole building, but it's only a part of the building that belongs to us. Product classes that we have homeopathic medicines, that's our heritage. We have medical devices, natural cosmetics, and we even have some food supplements. We are approved, GMP approved, good manufacturing practices. We are certified by Swissmedic, which is the Swiss governing body, FDA from US, ANVISA from Brazil, who's considered the most aggressive throughout the world, ISO, etc. So we have all the necessary groundwork for our business. Our head office is nearby Zurich in Switzerland. We have subsidiaries in US, as mentioned, in UK, and also in Holland. Today, we are active in somewhat 19 countries. I will show you later on a little bit more the map throughout the world where we are active. If we have to present our company in somewhere in the world, this is a one-pager if you want. I don't walk you through each detail here, but you can see up to the right that the US subsidiary was founded in '87, so 33 years already. We are in US active. Something that we are proud on, or let's start here down to the right, our earache relief product is the #1 ear pain recommended product by pharmacists. In US, on the other hand, something that we are proud of is there is an award throughout Europe from the company Reader's Digest that is called the most trusted brand. And Similazan has won this award for 15 years and even in a row, which makes us quite proud and speaks for the products and for the quality of the company. Maybe it even speaks for the team. And as you can see in the middle, quality is our DNA. We have somewhat 30, 40 inspections from all the regulatory bodies throughout the world. So quality really is our DNA, as it has to be in the whole pharmaceutical industry. Product portfolio, just a quick overview. Our focus is eye care, and we are, I will show you some market share numbers and data. Our eye care business is our focus. And you can see here, we have indications like dry eye, allergy, conjunctivitis in the sense of pink eye. Then we have some further indications on the right-hand side. So we have a full assortment when it comes to OTC eye care range. And on the lower end, you see our ear care business is quite big, especially in the US. And we have overall, we have some 150 products, mainly homeopathic, just to give you an overview how it also looks on the shelf. And whenever you go, for instance, to US, you should, whenever you walk into a pharmacy, I assume if you're looking for the Similazan products, you will see our packaging here. So our company, the heritage, is in Switzerland. And what I want to show you here is our market is not only the homeopathic or natural one. Up to the left, you see this is a total eye drop, eye care market in Switzerland, OTC. And you see there big companies like Alcon, you see Allergan, and others. And you can see in Switzerland, when it comes to eye drops in the OTC business, we are #1 when it comes to market shares. I would like to add something here. We also have the distribution of Thea Pharma, who you see in this chart to the right with the market share of 6%. So overall with the Similazan portfolio and the Thea, we own some 25% of the Swiss market, which we are quite proud of because the other guys are quite big ones. On the right-hand side, you see the brand awareness, also in Switzerland, natural remedies, and that's even from this year. We have a spontaneous awareness of 19% in Switzerland. When it comes to the supported brand awareness, we are even up to 70%, which for a small company like we are, is another good indicator. Overall, if I have to explain our company Similazan, what we are proud of or what our USPs are. So one is the brand in Switzerland, that is one thing. And on the other hand, it's the distribution in the US. Here on the left, on the right-hand side, you can see our distribution and the channels. So you will find us in almost every channel throughout US, which means our company was able to have a great distribution in US. You see the most powerful and largest pharmacies in the world, like CVS or Walgreens. They have, each one has about 9,000 POS in US. You see Walmart on the upper end, the largest retailer in the world. And then you have all the others like Kmart, Rite Aid, etc. So that is what we achieved in the past. When it comes to market share in the US, you see there's the big guys like Sustain or Refresh with market shares of 19 and 17%. And then is the middle, that's where we are. We own 3% of the market, quite fast growing. We are, when you take off the private label business, we are ranked #8 in the total eye care business. And again, #1 in natural. So whenever somebody is looking for natural eye drops, we are, even in the United States, we are the #1. And last but not least, where in the world are we active? Starting from Europe as a Swiss company, over the years, we grew quite well in the United States, North America. So North America is by far bigger even for us than the Swiss and the European business. And when I started, I've been with the company now for 12 years. So our strategy was, okay, we are strong in North America and South America. For whatever reason, they had a quite strong support for the homeopathic business. And so we decided to go that direction. Today we have the 5 interesting countries, also economically interesting. We have our business like Brazil, Colombia, Chile, Peru. That's the most important ones. On the other hand, you see we are in South America. We've been doing business for 20 years now. And what we have, because we had limited resources, we couldn't go or spread out throughout the world. So we had to focus on Latin America. Now that we are happy with our distribution and the markets that we have there, we decided to go east. And that's your direction where you are. And I think that is also a very interesting part of the world for natural medicines, because you have that's part of your culture, you know better than I do. But we think that might be an interesting area of the world for us, knowing that TCM, traditional Chinese medicine, and others are very strong, and the homeopathy as a concept is not known in each country, because it's basically it comes from Germany, and it's not known all over in Asia. But still we're finding our ways to step into markets, and there are 2 that I would like to explain a little bit. We launched last year, 2019, with the e-commerce strategy. We launched China with a partner. The company is called HCP. You can read that on the midsection. Chinese German company, and they are very present, at least on the online platforms like Tmall, JD, etc. And we are quite impressed how the Chinese market is growing. On the other hand, one didn't think, but Myanmar, not very strategically, but it was a coincidence that we were able to find a partner and have distribution for 3 years now. And even there, it goes better than we anticipated. So that's why we think Asia might be a quite interesting part for us. So this said, I come to the end of my presentation, and I hope I could give you a very quick and dense overview of our company and what we are doing. Thank you very much so far, and I would either give back or open the floor for any questions.
Okay. Thank you very much, Mr. Lehmann, for your explanation. In the meantime, while waiting for questions from the participants, I have a few questions to ask to you, or maybe any other speaker would like to ask directly Mr. Lehmann now. Okay, please go ahead, Mr. Ferry, speak now.
Thank you so much, Mr. Lehmann. Thank you for the presentation. So this homeopathic concept is well established in the US, but how do you see this also in the other part of the world, especially Southeast Asia?
Yes, that's a fair question. So we are finding our ways. This is a regulatory question, basically, and we found our way to translate, let's say like this, to translate the concept into natural remedies, be it in China or in other markets. That's quite time consuming and needs some brain work, but basically it's not too difficult. So that the ingredients remain the same. It's a different treatment in the manufacturing, but we found the way how we can translate. That's once in a while, it's like a language.
Thank you.
Okay, I will ask in a question if there is no one will ask Mr. Lehmann. Mr. Lehmann, if I'm an Indonesian company here and I have some products that I believe is sellable in the US market, now if I want to cooperate with you, what kind of product you think is you can leverage on your marketing network, and what kind of partner that you're looking at from Indonesia to work with you? I'm a very straightforward guy here. Yeah, please go ahead.
So you come straight to the point. So thank you very much for giving me the floor for that. So I think our eye care range is quite unique as it is natural and it's a full assortment. You will find natural eye drops, 1 SKU, 2 SKUs all over the world, but having a whole range covering the main and core and almost every indication that you can find in the OTC business, I don't know any other company, eye care company, natural eye care company throughout the world. I think that's the USP that we could offer to any Indonesian company. So I would go with the eye care range. And so if somebody's interested, or who are we looking for, I think it's important, and we have our, there's a lot of people that are interested, but really to make this a successful partnership between, let's say, an Indonesian partner and the Swiss partner, I think it's important that there is not only a market expertise, having contacts to the pharma or pharmacy business, but also in the regulatory. Regulatory, as I said before, we have to translate the homeopathic concept, and that's one of the key skills that is needed either within a potential partner, or at least that partner or company should know some consultants, whatever. Not too difficult, but I think that's very important.
Okay. Okay, thank you for your explanation, Mr. Lehman. Then, one question then. Now, because you have your eye care product range is quite solid, and then I believe that to enter Indonesian market, you will start first with your eye care, or because I also see that you have some natural cosmetic product on your shelf. Yeah.
Yes. Again, our assortment is much bigger. It's larger. We have a natural cosmetics line. For sure, we can talk about everything. But me personally, I'm a big believer that if you walk out the door from your home base, which is Switzerland for us, you should start with the portfolio, which is really unique, and you're one of the best in the world, or maybe even the best in the world. So if you ask me if that's the premise, it's eye care. But for sure, if there's any interest in any other indication, like injury, sleeplessness, whatever, we have products. And we can talk about everything if anybody is interested. Our natural cosmetics, it's also Swiss quality, manufactured in Switzerland. We have 3 lines for skin that have problems, so medical approach, for younger skin, for older skin. So I think even there we can cover the whole range.
Okay. Okay. Well, one last question then. I promise this is really the last one. Because as mentioned by His Excellency, we have more than 30,000 of herbal plants. Let's say there is this active ingredient which you think is beneficial for your product. You can incorporate that. I, as a supplier, if I want to sell it to you, what is the requirement of the supplier? What are you looking at? We know it's price and quality is a typical factors, but what else aside from that 2 factors? Yeah.
Yes, as you know, the authorities, they're getting stricter and stricter. So we are very interested in mother tinctures and ingredients from all over the place, even new products. What we need is the paperwork done. So we need, if you are in the pharmaceutical industry, you need a documentation. Now I found the word, sorry for that one. Documentation on the ingredients that we have to deliver to Swissmedic, to FDA, or to any other authority. And due to the safety, consumer safety, which is important when it comes to pharmaceutical products. I think that's the most important point, that we get the accurate documentation. But if that's available, more than welcome, more than welcome. We are highly interested.
Okay. Okay, thank you for explanation. I think we don't have a further question at the moment. Then we can go next with the next speaker here. Please welcome Ibu Paulina Panan. She is representing Ministry of Research and Technology of Indonesian government. And once again, thank you, Mr. Sulaiman. And the floor is yours, Ms. Panan.
Okay, thank you very much, and good afternoon, everybody. Good morning to friends from Europe. My name is Paulina Panen. I'm representing the Ministry of Research and Technology. My apology that Professor Bambang Brojonegoro could not attend this webinar because of other agenda. We are going to introduce you to innovation in Indonesian herbs, especially during the COVID-19 situation in Indonesia. If I may, can you see?
Yes, I can see
Okay.
that. Yeah, go ahead.
Right. First one, we have the background, the situation in Indonesia right now. Well, it's challenging for us. The fact is that 72% pharmaceutical industry are local company, but with 95% imported raw materials. So we are very highly dependent on raw material from other countries. And then we also have medical equipment industries, which is growing 12% per year, and it's really good for us. But 90% are imported equipment. So that our industry in Indonesia is just a kind of assembler. Everything, the spare part is imported from other countries, and then it's going to be assembled in Indonesia for the reselling. And then the other one is that we have the local industry, especially pharmaceutical industry, that is being what we call registered in our country. It's about 233 companies. I believe now is growing. And then the medical equipment industry is about 276. So when we were faced by the COVID-19 during especially February, March, and April, we were really in kind of chaotic because the fact that we don't have enough medical equipment to handle the COVID-19 pandemic, and we do not have enough knowledge about the medicine and the treatment, etc. So we were really in great shock. We can call it that COVID-19 is a really great shock for all of us. However, ladies and gentlemen, although the situation needs more push for encouragement for us, government of Indonesia has already committed for acceleration and development of pharmaceutical and medical equipment industry. And especially, actually, it has been started from 5 years before. Especially actually is the presidential instruction number 6 2016 about the acceleration and development of pharmaceutical and medical equipment involving 12 ministries in this case that guarantee the availability of raw materials. Especially we would like to increase the raw material coming from Indonesia, and then also increase competitiveness, increase mastery of science and technology for our own students, our own researchers, and then increase self-reliance for production process. So we would like to have actually companies in Indonesia for production process. We don't need to what we call export our raw materials to other countries. That's actually what we want. And we also provide the ministerial decree number 17 to 2017 actually with the action plan, which is concerning the investment and research-based production, and then also generic medicine, and also investment protection for export. Based on that commitment, we developed strategies in Indonesia. First of all, collaborative research and development. So we partner with companies or factories from foreign countries to work with us together. And then we also do the manufacturing with, we are very conscious about the quality and efficiency, and we try to support the infrastructure for industrial growth. We also have regulation for industrial growth, including the what they call tax deduction. And then we provide also trying to provide the ABGC forum, academician, business, government, and the C is the company forum. And then we also trying to provide competent HR through various scheme of scholarship. And what we can do in ABCG synergy is that we can have the academia to do the research and also the innovation there, and then the government providing the supporting regulation, and the business, of course, later on implement technology of production while also adopting our innovation and then leveraging to mass production, and then the community later on to be the end user. On the principles of the ABGC synergy is trust, mutual understanding, agile, and driven by competencies, knowledge, finance, and support and legitimation. However, we also experience the transformation of pharmaceutical and medical equipment industry. That is, usually we import raw material and then formulate the design and then manufacture and distribution. Right now, based on the presidential instruction, we have the research and development, we have the intermediate process, we have the clinical trial, and we also try to use our own materials, so that later on we formulate and design in Indonesia, and we manufacture in Indonesia, and we distribute. So this imported raw material is transformed into 4 activities, which is based in Indonesia. So we expect that the pharmaceutical industry will flourish through that way. And we notice that within pharmaceutical industry in our country, there is a regulation to have the 3 steps before it can be it can be called, the result, it can be called as medicine, or we call it in Bahasa Indonesia obat. Okay, the first one is traditional medicine research like jamu, and then the other one is standardized herbal medicine. This is supplements, for example. And then the other one is phytopharmaka, which is actually medicine, obat for what we call curative purposes, but based on the raw materials from Indonesian materials. Now we are talking about Indonesian herbs and the potential of Indonesian herbs. As His Excellency, Mr. Ambassador has already said that Indonesia has a long history with the herbs, and especially Indonesia has already been called mother of spices. And Indonesia also the first producer of clove and vanilla, and the second producer of pepper and nutmeg. And we are also famous in the world with Jalur Rempah Herbs Trail, which where Marco Polo comes to us following that herbs trail. And now Indonesian herbs has become the export commodity number 4 in Indonesia. The first one, like we have said before, Indonesian herbs is used for Indonesian jamu. Jamu is made of various spices and herbs. Traditionally, it is like this. It's a liquid made homemade or manually made by the lady over here and drank by everyone. But later on, it was transformed into sachet or liquid in a bottle. And then we have a warung jamu or jamu stall everywhere in Indonesia. So that's the situation of jamu, the evolution right now. And then we also have the herbal supplementary. that is one step beyond jamu, so one step above jamu. Herbal supplementary made of various herbs and original plants, and it is daily supplement for health or immune systems. We have various over here right now. I'm happy to say that, like for example, sambiloto. Sambiloto is for immune system, and it is very bitter if you take the leaves by itself, but now it is you don't feel you don't taste any bitterness at all because it is being encapsulated in a capsule. So there are a lot of other what we call plants and that is made for herbal supplementary. We also have right now the movement of what we call Obat Modern Asli Indonesia, or Indonesia Original Modern Medicine using the herbs. And I believe Pak Sutrisno from Dexa Medica is here. This is the situation where Pak Jokowi, I believe, visited Dexa Medica last time. And also our minister, Professor Bambang Brojonegoro, was visiting Dexa Medica. And then we also introduced some books about what are the Indonesia original modern medicine, especially using herbs. Well, this is the picture given by Dexa Medica to our minister. This is what we call illustrating the chain of business from the farmers into the production of raw materials, becoming the raw material itself, and then goes into the factories, and then resulted in medicine or supplementary materials, supplementary daily health, and then to be exported or included in the e-catalog in our country for what we call merchandising, yeah, for Indonesian patient. So this is the line of business. And in terms of COVID-19, actually, just in March, we were forming what we call the Consortium of Research and Innovation for COVID-19, consisting of various agencies over here. There are higher education institutions, hospitals for clinical trial, and then researchers from Batan, LIPI, etc. And then also there is professional association, and also what we call private sectors here, and ministers, a lot of ministries. Especially for herbs, we notice that it is being researched and innovated for prevention to increase stamina and immunity, and it has been studied as such using bioinformatics, that the most, for example, the most matching enzyme for COVID-19 has been guava, jambu merah, and daun kelor, and one more I didn't remember, but mostly is guava and daun kelor as one of the product of Consortium of Research and Innovation for COVID-19. Those herbs right now, the guava, daun kelor, etc., are being what we call a clinical trial at the Wisma Atlet, our main hospitals for the suspect of COVID-19. The Consortium of Research and Innovation actually doing a lot of things, not only the prevention, like using the herbs plant, empon-empon, jabu biji, kulit jeruk, etc. But also we are doing the therapy and medicine research, and doing the screening and diagnosis innovation, supporting equipment innovation, and also researching the social and humanity aspect of the COVID-19 in Indonesia. So we have quite a range of research and innovation. The most famous, like I said over here, has been some of the what we call herbs in Indonesia being right now clinical trial after being systematic review and studied in terms of bioinformatics, like jahe merah or red ginger, echinacea, maniran, and then sambiloto. I don't really know the English form, the English word for that, but like for example, also include curcuma, turmeric, cinnamon, lemongrass, celery, cloves, morning leaves, pace, soursop, mangosteen skin, lemon skin, guava, etc. Okay, they are being clinical trials so that they will be standardized as medicine, not only as jamu. Now, the process has been led by LIPI, who are presenting to us what they call immunomodulator candidates from Indonesian herbs. Several, actually, they are doing it in Wisma Atlet for clinical trial, including PT Kalbe, Bintang 7, Gajah Mada, and also PDP. This is a kind of professional association. Okay. Now, the most interesting result has been, according to EP, 3 types of herbs that is being clinically trialed now. That is the red ginger and Cordyceps militaris, and also combination of some herbals. We are also expecting that innovation for Indonesian herbs is not really stopping at that point alone, but we want to also calculate that Indonesian herbs can be later on boosting Indonesian economy, as has been right now number 4 of export commodity. Perhaps later on it can boost Indonesian economy more, and we noticed that the result of the research has been proven that herbs is useful for COVID-19 prevention, and especially very famous for the empon-empon, for the tolak angin, etc. And then right now we are having actually 370 proposals coming for the second batch of innovation proposal for COVID-19. We are working on it. If any of you would like to join the what we call the collaborative research, that will be much appreciated. And ladies and gentlemen, to answer the Similasan just now about the eye care, Indonesia has a very traditional eye care. Actually, we call it bunga telang, like this. That is a very good eye care, traditional eye care in Indonesia. We put the flower into the water, and the water later on become blue. So we dropped it into our eyes. They said for the babies, for example, it will give a very bright eyes, but actually it can also what we call cure the infection in eyes, etc. This is very traditional, and I believe it, and I use it, and it's good. It's work. Thank you very much.
Thank you very much, Miss. Yeah, okay. Thank you very much, Miss Panen, for your presentation. And Mr. Usleman just excused himself because he has to catch up for the next meeting. And maybe we should continue the presentation to Mr. Francis Wanandi to give a brief overview about the market in Indonesia. The floor is yours, Mr. Wanandi.
Okay, thank you, Jesse.
Yeah.
Your Excellency, Mr. Pamulyaman Haddad, thank you for the opportunity for me to present about Kadin or the Indonesian Swiss Chambers. So I'm trying to present. Hold on, let me go through my presentations. Give me a few seconds. Okay. Can you make it bigger, Janet? So basically, as you know, that Indonesia has a vast population of 260 million. So there's an opportunity for Swiss companies to invest in Indonesia. And as you know, we are the fourth biggest population in the world. At this moment, we are very highly required for foreign investments to come to Indonesia. So there's a big opportunity, as Madam Pauline mentioned today. So it's a good timing for anybody who wants to invest in Indonesia because all the facilities are being provided at this point of time. Next. Next, Janet. So what are the components to win in Indonesia business? Can you go before? Okay. One, of course, is Indonesian export product or services to Switzerland or neighboring country, SEPA, EFTA at this point of time. So we have a tax incentive or tax benefit for it. The second would be having attractive Swiss companies to invest in Indonesia and becoming also the local partners. Thirdly, we can create partnerships so that Indonesia companies can become one of the Swiss global sourcing in the world. As you know that a lot of Swiss companies do have global channels. Fourthly, Indonesia company becoming Swiss brand distributors or products or services. And lastly, of course, Swiss company investment who can own 100% ownership in Indonesia. Next. So these are some samples of if Indonesian products would like to go to Switzerland. That as you know, Swiss companies or Swiss as a country, consumers are looking more and more towards organic products, bio-certification, free palm oils, low lactose, glutens, vegans, or never fried products. And maybe some Indonesian who wants to invest in Switzerland or in Europe, basically, we can also add up some Indonesian characteristics as well. Next. Next. So Indonesians exported mainly those items from gold to spices to coffees and chocolates, shoes, textiles, and then wood products, fruits and vegetables, and so forth. So those are our main exports to Switzerland. Next. These are examples of how Indonesian can be a toll manufacturers or sourcing from Indonesia to Switzerland. So Indonesia also now, because of our labors and our skills, I think it's a good time as well that maybe Indonesia can be an alternative for toll manufacturing for Swiss products or Swiss brands. Next. For Indonesian as well, as you know, that Swiss has a lot of partners that we can cope up. Mainly, if you want to sell FMCG products or goods products, there are two main players in Switzerland, Coop and Migros, and then you can all have like BioSwiss and so forth, quality that the Swiss markets and mainly European markets are willing to have as a standards. Next. These are some examples of Swiss companies that has already invested in Indonesia. Some of them own even 100% ownerships. Some of them are setting up joint ventures. APL is a Zulik family from Switzerland. They are mainly the biggest distribution companies in Indonesia, mainly on pharma products. You do have ABB, you have DKSH, Stellars, and so forth. So there's a lot of Swiss companies now do have Indonesian partners or they invested 100%. Next. These are also an examples of how Indonesian companies can be global sourcing of Swiss products. So PT Santoso Teknindo, that's in precising products, metals. So they're already becoming the global suppliers of Swiss companies. Next. These are those Swiss company who owns 100% ownership, because certain category of industries that foreign investments can own 100%. So Nestle is an example, Novartis and Roche. Those are examples of big companies, Swiss companies that are already existing in Indonesia. Next. So what are the incentive or the attractiveness of Indonesia as a manufacturing hub? First of all, as we know that we are in the process of having the SEPA EFTA, so that we can be more competitive than our neighbor country or even China, Malaysia, Thailand, or Vietnam. But the other thing as well, that as you know, is Indonesia has a large workforce and giant domestic markets with 260 million people. We do have a dynamic industries economic and strong long-term growth prospects. Despite there's a COVID now, but we believe still that Indonesia can grow strong in the future. Access to ASEAN markets, as you combine the GDP as before the COVID was $2.9 trillion in the ASEAN markets. And for now, we are in the process of, especially on tax holidays, investments, labor law, and so forth. So I think by having that is an opportunity for foreign investments, especially we're inviting Swiss companies to come to Indonesia and looking for opportunities. Next. Just fast that, those are some priorities that Indonesia do have at this point of time in terms of manufacturing, constructions, mining, and quarrying. And regarding herbals, of course, in terms of agriculture, forestry, and fishing, these are some items that we are looking forward to have investment in Indonesia. Next. Those are the expected growth. Again, those are the numbers before the COVID, but we do hope that it remains still the same. As you can see, one of the largest growth that we are expecting are chemical, which is 11.5%. That including pharmaceutical products. I think we are still expected to have even double-digit growth from year to year. Next. Okay, what are the key trend and opportunity in selected sectors? I'm just going through on the chemical because these are maybe tied up with what we are talking today. First, as you know, Indonesia now do have what we call universal health insurance coverage, leading to all increasing demand for healthcare products. Expansion of agricultural activities and industrial products, also coupled with a lack of domestic product capacity of chemical products. And so it led to dependency of importing of raw materials. So something that Madam Pauline also mentioned, that we would like to have more independencies of producing raw materials locally. So this is something that can be attracted as well for investing together with foreign companies. Major chemical companies also have expanded their production capacity to meet the growing demand. So the opportunity again is to increase the demand for generic drugs and expansion of pharmaceutical product range used. Second, growing demand for agricultural chemicals and fertilizers. And also to have the gap has led the opportunity and strong growth in FDI in certain products like paint, coating, adhesive, basic chemicals, and so forth. So those are some of the opportunities that occurred at this point of time for Indonesia toward the foreign investments. Next. A bit touch of maybe food and beverage, maybe because some of them may be related. Again, is Indonesian markets are growing health conscious, especially during after the COVID. A lot of people are drinking or consume more healthier products. Expansion of the modern grocery retail channels, And thirdly, also local food manufacturers adopting to more modern technologies and produce more and more food and improve efficacy and qualities. And as we know that the Swiss are very good in this kind of category as well. Again, the opportunity is to demand for health and wellness packaged foods, either organic, free from or better for you, or fortified products, or etc. And locally produced food processing machinery, mostly simple technologies, and having local suppliers in food and beverage manufacturers. Next. So what are the opportunity businesses after the COVID-19, which Swiss business industry will likely to invest? We are really looking from the CADIN point of view, or the Swiss chambers of commerce, in the health-related industries, marine industries, garments, and FMCGs, or fast-moving consumer goods. So we do hope that we can grab this opportunity, and hopefully by after the post-COVID-19, those kind of categories can be realized as well. Next. Just quickly, as you know that because of the COVID, we cannot go out. So the trend of having digital transactions has increased tremendously during this COVID. So maybe something that we can also look at it for the future. Like groceries, for instance, because of the COVID, the market of e-commerce has increased by even 400%. So those are the things that maybe we can look it forward in the future. Next. So moving to a bit more herbal, as Madam Pauline also mentioned, that we do have a lot of cooperation, even with some European universities and local university, to develop products range doing those research, so that new entities or new chemicals or substance can be created and developed together. Next. Again, as you can see here from the slides, natural ingredients, vitamins, or antibiotics becoming one of the biggest import commodities by Indonesian pharmaceuticals, mainly coming from India and China. But we do hope that those can be also found from different sourcing other than those two supplies. Next. On the traditional medicine, we don't have, even though we do have heritage quite a long time, but at this point of time we don't export a lot of our traditional medicines, mainly to Asia market at this point of time, like Bangladesh, Pakistan, Malaysia. So those are the things that we do hope, if we could cooperate together, we can start to bring export of our traditional medicine overseas as well, and mainly the European markets. Next. So what are the categories that are popular in Indonesia and greatly that we can explore on the non-medication markets? We are very popular in body slimming products. Secondly, male stamina. The third one are gastro products. And then antioxidants and analgesics. So those are the main category of herbal products that are popular in this country. Next. So the majority of our traditional, the majority of our herbal products are based on the self-made herbals medicines. So those are the biggest market share at this point of time, and followed by herbal medicines. So basically, the most commonly developed products with no standardized efficacies. So those are the second categories, biggest. And then moving forwards to what we call a standardized herbal medicines. So those are herbal basically that has increased local product competitiveness and has qualified efficacy tests. And then the smallest segments are the phytopharmaca. So those are the higher levels of standardized herbal products. But again, those are kind of small, but growing fast, thanks to also Padexa, Paferi also is part of it in growing those segmentations. Next. So we expected the next 5 years, the market of traditional medicines in Indonesia will grow up to around 1.1 billion US dollars markets. This is relatively small, but we do hope that that can jump further after this COVID occurred. Next. So the other attractiveness of Indonesia is we are one of the 3 top countries in the world that has variation of spices. So these are something that maybe a lot of Swiss manufacturers can explore and come to Indonesia and look at it, what sort of variety plants that can be utilized for your your herbal products in Switzerland or in Europe. Next. Within Indonesia itself, you can see here from the trend number of type of species of plantations. You can see the top numbers are in Kalimantan. We do have about 4,000 type of species of plants in Kalimantan, followed by Solo or center of Java, and then you have Riau, Jambi, and so forth. So nationally, I think those are the places where we are looking for opportunity that we can do searching of doing these plantations in the future. Next. Next, please. Again, the type that can be done. Next, sorry, before that. Janet, before this. Okay. So again, on the left, you can see that what are the use for Indonesian herbal medicine consumption purposes. You can see here 22% are more on the curative sides. The second or 22% are health promotions, and then 49% are basically preventive medicines or preventive health. So those are the type of categories. And then you can see from the pharmaceutical products, the biggest are the ginseng-based products, and of course the second will be the Zingiber officinal. I'm not very familiar with those terms, to be frank with you, but those are some of the categories that are popular at this point of time. Next. Again, the importance of herbal are still selected to their quality of manufacturing. So mainly the importation of herbal products in Indonesia are coming from China and India. Those are from the chart are the samples of products that are already existing in Indonesia for herbal products from overseas. Next. Already mentioned before, those are the standards of herbal products. So we have the herbal medicine, we call it jamu, the standardized herbal medicines, and the phytopharmaca products. So those are the segmentation normally, where the jamu is more for low and middle classes, and then the standardized herbals are more mid levels, and phytopharmaca mainly for the mid and upper levels of consumers. Next. So last 5 slides saying basically how can we successfully invest in Indonesia, mainly on domestic natural ingredients that require agriculture's quality, human resources, and infrastructures. You can see from the slides that on the agricultural side, that we need to have selection or selecting superior seeds and preparing soil which suit the plant characteristics. And I think Swiss has also very good science on that. Optimal development, selection, and fertilization know-how, or minimizing also the risk of damaging plant and soil while harvesting those plantations. And then the second will be on the process technology know-how, on do plant extractions and international business market as well. What are the categories of plantations that occurs or demand globally? Human resource as well as importance on multidisciplinary coordination, on pharmaceutical, chemical engineering, businesses, environmental engineering, and so forth. Of course, the natural resource experts to have provided tax holidays, and as mentioned by Madam Pauline as well on the ABCGs. And then we're also looking to capitalizing the added values. And lastly, on the infrastructures as well, so that all can be integrated together. So that's basically my presentations on natural resources, on the herbal products. And I do hope Pak Ferry can be more details because he's the players on that. I give it back to the moderators, please.
Thank you very much, Mr. Francis Manandi. Please continue with Mr. Felix to give presentation about the PT Dexa Medica. The floor is yours.
Thank you very much, Pak Jesse. Good afternoon to everybody in this special webinar. First, I would like to thank and also recognize His Excellency Ambassador Professor Mulyaman Haddad in Bern, and also Ambassador Samsul Siregar in Geneva, and also Ibu Paulina Panan from Kemeristek, BRIN, and Pak Francis Wanandi and Pak Jesse Young. So this afternoon, I'm very pleased to be invited to this webinar, and I'm here together with my colleague, Dr. Raymond Chandrawinata, who is the Executive Director of our research unit and also in charge for our strategic development and medical affairs. So let me share with you who is DEXA is and what is DEXA doing in this kind of herbal area. So our company was established in 1969. So last year we celebrated our 50th anniversary, born in Palembang, South Sumatra. And our core purpose is very clear here, expertise for the promotion of health. So until today, we started with as a generic pharmaceutical company from South Sumatra and then goes nationwide. And we are also now exporting to different part of Southeast Asia, Africa, Europe, UK, and also to North America. And I think we are well positioned now as one of the market leader in Indonesia. So at a glance, Dexa Medica was established in '69, and we are now in the top 5 Indonesian pharma company in Indonesia, mainly in prescription medicine, generics, and also different dosage forms. And I think one of the very distinctive differentiation of Dexa that we are also establishing our research. So now we operate 4 different state-of-the-art pharmaceutical manufacturing facilities in Indonesia, also meeting different GMP certification. For sure, it's the Indonesian FDA, but also our plant in Jakarta has been certified by UK MHRA and several other German states. Yeah. So our export, as I mentioned, is now we are active in 4 different continents. The second important bullet points, Dexa has also building a very strong experience in strategic alliances. And I think we consider ourselves as a partner of choice as we have many multinational companies in our strategic alliance from 1996. And 2005, there was also a very important year that we embarked into our research and discovery efforts, especially when we treasure our Indonesian biodiversity. I think we are the second largest biodiversity from Indonesia in the world after Brazil. And we are also very much blessed with so many experience that we have from our ancestors that we have been hearing from our ambassador today. So that's why in 2005, we established our DLBS or DEXA Biomolecular Laboratories of Sciences. And this is really our research campus in East Jakarta. So now this activities has also given us many products, and this product now is also well supported by our bioactive fraction manufacturing plant next door. So when we look into DEXA activities nowadays, I think we are very proud that we are also been able to establish our end-to-end competencies, not only starting from manufacturing back in 1969 and then do commercial and distribution, but also in 2005, we established our research and discovery in the LBS, and later on supported also with another campus on development that could be for our generics and also for our herbal-based products. But more important, Bapak and ladies and gentlemen, that we are also now working with many group of farmers in Indonesia, because we want also to have this collaboration backwards with many farmers in different parts of the world, in Indonesia, in Sumatra, in Java, and also different part of the archipelago. So when Professor Paulina mentioned about our shock in supply during beginning of this year on raw materials for pharma, that's really another turning point for Indonesian companies and Indonesian government, that we have now really to look more seriously and urgently to develop our own raw materials using our Indonesian biodiversity. And I think DLBS and DEXA is well positioned in the front line because we've been able to provide or to produce different bioactive fractions based on our research, supported by clinical trials in human and also preclinical trials with animal in the before that. And later on, the product is being manufactured in a GMP standardized facilities that we have. Yeah. So that's really very important now. We are also working very closely with our government. How can we also really make this dream a reality, that Indonesia start to build its own self-reliance or kemandirian in raw materials based on herbals. So this is the picture of our DLBS, our research campus, and we are very happy that we have more than 250 scientists working here. And in the bottom here, we can see there's many products has been coming from this facility. And as Ibu Paulina or Pak Francis mentioned, some of them are in Jamu classification, but more of them are in the standardized herbals. But also, we have now many phytopharmaca that's coming from our research. Yeah. And down beneath here, you can see that our facilities is now also performing different activities using the golden standards of clinical trials and good laboratory practices, good and so on, GMP and so on. And lately, we have also our halal certificate from Indonesian institution. So now, ladies and gentlemen, in this important slide, I want to share with you, we've been hearing today that many of our herbals.
Mereka berlomba-lomba gimana mikirkan. Kenapa ya? Itu tadi saya sudah utarakan.
Yeah, if I may continue. I think from this slide, we can see that many Indonesian herbals are produced in this middle group. And even in Indonesia, we are also importing some basic herbals from outside, from a different part of the world. But now in our route, DEXA is performing research using Indonesian biodiversity only. So this is our first commitment. We want to do research using Indonesian herbals based only. And the outcome of these activities are really our bioactive fraction with a certain process, some patents, and our patents is patented in Indonesia or different in different countries, even in WIPO in Geneva, and also supported by clinical trials. So from this, then we have also our manufacturing capabilities of raw materials that based on our research activity here. And the outcome of this is really now our extract that later on we formulate in our formulation labs. So finally, we can produce good tablets, film-coated tablets, some even enteric-coated tablets, and also different capsules. And these are now really being manufactured in our pharmaceutical plants in South Sumatra. And in the bottom, we can see now, these are the 4 phytopharmaca that DEXA has from 2004 all the way until now. Yeah. So now I think this slide is really now to emphasize that our commitment from the beginning is to use Indonesian biodiversity. And we can see this Meneran or Philanthus niruri is Indonesian-based immunomodulator that's really growing a lot in different parts of Indonesia. But now we have identified and a good validation process that we are using only this Philanthus niruri from one area in East Java. Mahkota Dewa is another very unique product from Indonesia. And we have developed this product beyond the belief from our ancestors because we are supported by many clinical trials and we can prove that. And then we have also ikan gabus to take also many protein from this, especially for healing process, post-surgery and postpartum and so on. And then redasit is being used also for limiting our hyperacidity. and this is working on the proton pump inhibitor. And this is now what we use is the cinnamon burmani from Sumatra. And then the last we are using also earthworm. This has a lot of protein, and this is really working and well proven and being used by many cardiologists or neurologists for antithrombolytic and so on. So, ladies and gentlemen, these are a few slides, a few proofs that we have that what we do right from the beginning with a strong commitment and also high courage and using the high level standards can also bring quality products. So what is the outcome of this? So Lextimono is our immunomodulator from Indonesian Philanthus niruri, recognized by Indonesian FDA in 2004, and until now, and especially during COVID time, either the capsule for adults or liquid from children is well used, and it's all supported by many, many clinical trials for many, many years. And these are the collection of our activities in the clinical trials and so on. It's well documented. And then in summary, I think I can share with you that Dexa Medica has established our end-to-end competency, especially in discovery and research of various Indonesian biodiversity. And now we have 3 different outcomes. It's important that I want to share and offer to the audience that we have a proven bioactive fractions supported by preclinical trial and clinical trials on certain indication. And second, we have also now come up with many phytopharmaca. Yeah. So for example, I showed you about inlasin. There's a very good example here. Inlasin is for diabetes, right? So this inlasin, we know how it's working and the mechanism of action, supported by clinical trials, and it can also lower HbA1c by about 1 to 1.1%. And now this product is also now compatible or can also have a head-to-head competition with metformin, for example, the first-line therapy for diabetes patient. And I think this is really our hope that this product will be more, supported by the Indonesian government and also many other countries, so they can be used for many, many diabetic patients. And we know non-communicable disease, especially like diabetes, is growing everywhere, and everybody has also to take care of their blood level, glucose blood level, and to make sure there's no further complication in their life. So that's why the product selection is also well thought of, and I think now we have a few products already, phytopharmaca, and many other products in the pipeline. And the third outcome is very important, as mentioned before, that by Mr. Lehmann, that our product dossier, the documentation is very important. So this product can be also registered in different markets. And I think we have proven this, that our herbal products went to Canada and the US last year or 2 years ago. And I think this is really showing that our product is well accepted in different parts of the world. A second bullet point, we are also supporting ourselves with manufacturing capacity for both extraction and also finished dosage form. And last, very important that our product is well accepted in different parts of Asia, especially this herbal-based product, phytopharmaca, or standardized herbs in Philippines, Cambodia, Myanmar, Singapore, and so on. And last, also in Canada and the USA. So I think these are really the important sharing that I want to share with the audience. And I really hope this will give also some benefit for each of you. I thank you for your attention. Terima kasih.
Thank you very much, Mr. Ferry Signo. Going back to the other speakers, is there any questions? Otherwise, I will move ahead with my questions. Okay, then maybe I'll start first with the easy questions. I look at your presentation that you have a direct cooperation with the farmers, Mr. Stigno. My question to you is, so do you implement traceability, and do you also implement like a new way of doing business, like fair price or fair trade with the farmers? How do you build your cooperation with them?
Well, I think this is really a partnership approach, right? So many of my friends always asking, now Dexa is going to agriculture business. I said, no. We are focusing in pharma. So the agro side, we work with this farmer who has also the commitment, right? So both parties have to have a commitment. We're talking about our quality specification. We are talking because these all natural products. So in one year, the rain level is very high, and one year maybe it's a little bit dry, and so on and so on. But we have a very open and transparent agreement that we want to have the certain specification, right? And we also give them our expectation on our forecast. So they can also grow and prepare the raw materials for us with the right specification and also with the right quantity and the right timing. And last, of course, we speak about pricing. But I think the main philosophy that we always do in our partnership is really long term. And it's really good when, for example, we work with the supplier for this halal certificate, right? Then this earthworm, we are also training them. These are really now the expectation how to deal with your worms, how you grow your worms, so it will still meet the halal certificate when we process it further. And once we pass this and we get this certificate, we also share with them. And they are very happy and very pleased that somehow they are also being part of the, the supply chain, that their worm is also giving later on our raw materials, our protein with the halal certificate. So this is really how we bring them in the right motivation level, and we work with them for long term. And I think now for many, many years, they also enjoy the collaboration with us, especially when the business is growing, but also not only on the quantity, but also on the quality level, the standard level, that somehow will bring them also to a higher satisfaction.
Okay, understood. Is it difficult to build this kind of cooperation in your personal view?
Well, it has to be taking, two parties to tango, right? So we come to them, we have to see their activities, we show them this is our expectation, we invite them also to our plant, to our labs. They come also and they see what kind of, because sometimes, they have no idea where the product will be brought into and what kind of environment it's going to be processed and what kind of finished product eventually will come out with, right? So we embrace them, we talk to them, we come to their place, we invite them to our place, and so far I've been hearing only satisfactory report from their side.
Okay, I see. So thank you for your explanation, and also I'm very proud and excited to see a company like you focusing on our natural ingredients, our resources. And now I have a questions because the idea of this forum is to have a cooperation between Switzerland and Indonesia.
Sure.
And from your view, because you're also representing all this the pharmacy business in Indonesia, you're the vice chairman in this group. What kind of Swiss partner that you are looking for? Is it the one who can bring the capital, or is it the one who can bring kind of know-how? And the question also, what kind of know-how in terms of manufacturing, or is it in terms of marketing? Maybe you can share with us, at least in your view, what kind of the right partner for the Swiss company to get into Indonesia?
Yes, I think Indonesian pharma market is still growing, and many data has really been proven and shared that our medicine consumption is still very, very low. But I think nowadays with this few factors, right? So Francis mentioned about our universal health coverage. That has given all Indonesian the access to medical or healthcare system. So now from 270 million people, or 260 something, there are about 222 million members of this healthcare insurance. So now the expectation, right? I think the unit will go up. The price is going down very significantly. We've been experiencing price erosion like in many other countries. But again, later on after COVID, I believe there'll be a lot of change in the in the consumer behavior. Especially, I think we can expect everybody will be more preventive conscious. And second, I think we'll take more the medicine in the higher level of compliance, right? This higher discipline. If you have to take this tablet once a day, then you take it once a day. For hypertension, especially the chronic diseases, diabetes, and so on. So I think the consumption will go up. Now, what is very important, Indonesian market, 90% for pharma, 90% in units are produced by the Indonesian local companies and state-owned enterprise. So you can imagine there's 10 prescription coming to a pharmacy, then you can imagine 9 out of 10 are the medicine is coming from Indonesian pharma companies. So I would like to invite many other Swiss pharma companies who has distinctive capabilities or differentiation in their product, in their technology, to come to Indonesia to complement with the Indonesian pharma companies. Because most of the market we can supply. But there's some areas that maybe product is still under patent, maybe there's a new approach, maybe there's a new delivery system, and so on. So we are very much open. So when we spoke, for example, with Lehman, I think it's also important to bring the concept of hemopathic to Indonesia, right? Yeah, I used to live in the US for many years, and I know hemopathic is big in the US. But in Indonesia, we believe more on the jamu, and now we're going up to the standardized herbs and even phytopharmaca. But again, there should be room if we want to bring and give the patient or the consumer more options. So coming back to the question, there are many Indonesian companies who are also very much open to work and ally with different Swiss companies or different companies coming to Indonesia. Second, we are also part of this global network. And my company, for example, Ferron, in 2008. So the company was established in 2003. But 5 years later, in 2008, Ferron managed to get GMP certification from UK MHRA. It's not easy, but we managed to do so. And in 2008, we start to export our first product to the UK. And 2010, we ship our metformin sustained release to the UK. And now we are the second rank in the UK market for metformin sustained release. And last year in July, I think Pak Director Hendra Halim also attended our ceremony of exporting that metformin sustained release to Poland. And the product is also well accepted in Poland. So again, I think with the different registration or regulatory regimen in the in Europe, post-Brexit or before Brexit, I think we can also expect this product can be also registered in different other EU market. And somehow will also bring a good benefit to the, especially now in the diabetic patient, because they're using metformin almost every day, right? So that's why I think please also consider there are many Indonesian pharma companies who are also eligible and competitive to go and to enter to the regulated market like Europe. So I think that's the message from Jakarta, Pak Jesse.
Okay, thank you very much for that message, Ferry. And maybe there's this one last question from me. I don't see anything coming yet to my desk, but it is quite baffling looking at a lot of this import of the natural ingredients from China and India, as mentioned by Francis before in the presentation. The question is why? Is it because we don't have enough capital to have the machinery? Is it we don't have the enough human resources know-how to process? Or is it because the infrastructure, the water, and everything, or the import and system is a bit, difficult to get the product on time? Maybe you can share maybe the frustration from Indonesian side, and also that from for me as an external, to me it's like, what's going on there? Yeah.
Well, I think this is really giving the consumer different options, right? Different alternatives. Yeah. So some of them, they believe on the traditional Chinese medicine. Some of them, they believe on Ayurvedic from India. Some of them, they believe on the Korean products and so on, right? But the Indonesian, I think we should not underestimate that Indonesian, they still love and fond of Indonesian herbals. But now I think the offer to the Indonesian consumer is not only on the jamu level, but now we have also more different traditional medicine supported by research. And to do this research, we need also many factors, right? I think Ambassador Mulyaman knows this very well, right? We did the regulatory should be right, the investment climate, the human capital, the courage to do so, the possibilities of trial gets going south and in failure, right? So there's many other factors. But I think together in Indonesia, now our government is trying to pull everybody, the relevant stakeholders, to play such an important role to make it really happen. And I think we are now very excited that hopefully after this COVID discussions and handlings, I think we should be having a better and a stronger reason to build urgency. So to build more Indonesian herbal products with the level of, as Pak Research Minister mentioned, OMAI, right, Ibu Paulina. So this is really his concept when we spoke with him in January, that Indonesian modern medicine can be established and to give more confidence for the patient or the consumer to consume. And hopefully can be used in the formal medication system like the health insurance. So I think there are really some opportunities in front of us, but I believe as part of this big nation, we have to do it together. And it will come to a point that it will happen. I believe, and I strongly believe in that. Thank you, Pak.
Thank you very much for your time, Pak Ferry. It seems I have one question coming in. Hold on, I'll give it to the speakers.
Pak Jesse, can I ask a question to Pak Ferry?
Oh, please go ahead, Pak.
Yeah, Pak Ferry, thank you very much for a very interesting presentation. As mentioned earlier by Ibu Paulina, COVID make us all in shock, because of, well, I just learned that the 90% of the pharma inputs coming from imports, I mean, what's really the lesson learned, Pak Ferry, from the COVID? And then what action that we should take into consideration in immediate and then in the medium terms? How you see this from the pharma point of views? Because after COVID, I think we have to be more prepared because, the pandemic or the next pandemic could be very challenging, even more, a lot of people say even more challenging. So how you see this view from pharma point of view, Pak Ferry? Please, Pak Ferry.
Yeah, thank you so much, Excellency Ambassador. I think this is a very, that's why I said this is very strategic issue for the country. And what I experienced in the audience is also Pak Thomas Harsono, is my colleague from the association who is in charge of the raw materials activities. So I think we have experienced what we call it the global supply shock, starting from January, February, March, April, and so on. And this is when we are allowing ourselves and accepting the situation that 90% or most of our raw materials are still imported. But the lesson that we learned, Pa, exactly as you pin it down, now we have to move to a different menu, right? So now we have to somehow expedite the local production of raw materials. So Indonesia, in 2015, our association with the Ministry of Health have established a roadmap of development or pengembangan raw materials. And we have different schemes. And again, now, 2020, we have a strong trigger because of this COVID that we have to move faster. So the urgency is built within the government. Different ministries are involved right now, but I think it's still under a strong discussion. And I believe from DEXA, from the herbal route, I show you already, we have 4 phytopharmaca which are ready to be used, and they are using all Indonesian raw materials, herbals, right? So Stimono is using Phyllanthus nirori. Inlasin is using our cinnamon and also banaba or bungur. And then we have the dissolve is for antithrombolytics. For blood vessels, we use our earthworms. And the fourth is Redacid, is for hyperacidity on your gastroline. Then we use also another part of the cinnamon burmani. So that's why whatever we have during this kind of urgent situation, I believe, right, we should use what we have in our hand as soon as possible, instead of talking about wacana and talking about ideas and still waiting that this wacana will land somewhere someday, sometime in this country, right? So that's why now we are proposing to government, please make use what we have in hand. And Ibu Paulina, I have to share with you, to come up with this phytopharmaca, it takes a lot of efforts. Clinical trials is not done overnight. So Simono, 2004. Clinical trials was done from 2001, 2004. And then we come to Inlasin, phytopharmaca. The product came to the market 2011. And it became phytopharmaca only about 2015 or 16. 2016, I think, 5 years afterward. So that's why whatever in hand, I would encourage that we make use of it as much as we can while we are preparing our pipeline for the next products. So that's maybe Pak Ambassador, Pak Dubes, I can share with you my thoughts on this. And this is not only Wacana, but I think we are now in a very intensive discussion with the different ministries in Jakarta.
Thank you, Pak Ferry.
Thank you,
Pleasure.
thank you
Pleasure.
very much, Pak Ferry. Yeah. Maybe for the last speaker, I would like to invite Pak Dubes Syamsul
Okay.
from Geneva to give a little notes and also to help us to close this webinar event.
Yeah, thank you, Pak Jesse. Thank you, Pak Ambassador Mulyaman Haddad and all the speaker. I think we are very limited time, but just would like to share what we discussed in terms of the theme of this issue is medicinal plants. I just got the info, the data from the International Trade Center. I think it's very useful one because they have already provided the 2019 data. Make it like this. So the world import of the raw materials for the medicinal plants, HS code 121190, plants, parts of plants included seed and fruit used primarily for perfume and pharmacy and also medical herb is growing very fast. So the total import in 2019 only is about 1.6 billion US dollar. The biggest importer in the world, I could say is start from US, Germany, Spain, Japan, India, UK, Hong Kong, China, Italy, and so on. That's the first. Indonesia in the 59 rank. We import about 3.7 million, but at the same time, we have export of these medical plants about 15.1 million US dollar. So compared to Indonesia and Switzerland, we have already export about 15.1 million. At the same time, Switzerland also have export their medicinal plants about 4.8 million US dollar. So I think since as a exporter of the medicinal plant, Indonesia still have room to increase their export since the total of export is only 15.1 million. That's the first. Secondly, maybe to Mr. Lehman, if he is here still in the webinar. I think now in every pharmacy, especially in Geneva, I believe also in Switzerland, it's now very easy to find the medicinal herb, specially made from the curcuma. Everybody knows that curcuma is very important for us, especially if you are working hard, or especially during this COVID. I think since Indonesia also hopefully is one of the biggest curcuma producer, so let's maybe working together with Indonesia. And I also would like to say thanks to Pak Ferry. One of Indonesian who have 20 years already diabetic mellitus. So while I'm hearing that one of your product is good for diabetic, yeah, let's maybe promote this product into the Swiss market. I think that's all. Thank you so much. Hopefully we can maybe continue this discussion for a detailed one, so that we can increase our export to the Switzerland. Thank you again, Pak Ambassador Mulyaman Haddad. Thank you for the all. Thank you.
Okay. Thank you very much, Pak Dubes Samsu. Maybe this is the last word from this event, and I would like to thank everybody here, ladies and gentlemen, Pak Ferry, and also Pak Ambassador Mulyaman Haddad.
Perhaps Francis, do you would like to say something, Francis?
Oh.
Okay. Maybe just the closing statements. As you know, we do hope that from both sides, with the coming of SEPA EFTA, we can really use this opportunity for both sides, Indonesia and Switzerland, to have a more cooperations and look at all the opportunities possible from both sides. Of course, as a Kadin or Indonesian chambers, we would like to help Swiss companies as much as possible to invest to Indonesia, or vice versa of Indonesian companies, if needed, to look at opportunity to go to Switzerland. I think by having this COVID, we are also learning that, even though there's a tension around the world, but for those who doesn't have attention, we have to use this opportunity as much as possible to take advantage that with a good relationship of the two sides governments, I think we can extend it and increasing the cooperation even further. And we look at these herbal categories, as Pa Mulyaman mentions, can be explored more deeper and more seriously, so that the result can be fulfilled for the next 5 years. The downside, of course, as Pa Ferry mentioned, pharma takes a lot of time. So we need to have a long terms, but we need also to have a vision like Pa Ferry. We have to start from now, but hopefully we can pick up the fruits maybe 5 to 10 years down the lines. But it will be worth it for sure. And we do hope that the next 10 years or 5 years or faster, we can start to see, as Pak Dubes from Geneva mentioned, that maybe 1 or 2 Indonesian products of Jamu or herbal products can be on the shelf in Migros or Co-op in Switzerland, or in pharmacy in Switzerland. So that's basically my statement. Thank you, Pak Mulyaman.
Okay.
Okay.
Thank you very much, Francis Wanandi, for your message. Maybe this time is really we need to close this webinar, but the silver lining is it shows that the Swiss companies can complement the market in Indonesia, as mentioned by Pak Ferry Sutikno. And then even with the success that DEXA achieved in foreign market, it shows that Indonesian companies, they can also have the eye-to-eye level with the Swiss company in this pharmaca area. It is very encouraging, and also for the Swiss industries here. Yes, Indonesia is a big market, but if you're looking at the long run, we have a lot of this more than 30,000 plants, a lot of active ingredients that need further research and so on. And then even now we can build such a good R&D here in DEXA Medica with scientists to the proper to the proper phase 1, phase 0, phase 1 kind of typical pharma clinical trial. So Indonesia is a market that I believe is not only for short term, but it's also a long term for the Swiss industry. That's my message to the Swiss counterpart here. And then, yes, thanks again for your time, everybody, ladies and gentlemen, and His Excellency Mulyaman Haddad for your time. And with this, we conclude this webinar. Thank you very much. Until next time.
Thank you. Thank you.
Terima kasih.
Bye.
Terima kasih.
Bye-bye. Terima kasih
Bye,
buat
Pak.
para pembicara.
Terima kasih semuanya.
Ya.
Terima kasih.
Pak Peri, terima kasih ya Pak Peri.
Sama-sama Pak Dubes. Kapan-kapan ketemu
Ya.
ya. Ya.
Yeah. Thank you, Pak Ferry.
Ya.
Ya.
Ya, ya.